When her foal collapsed from a rare neurological disease, Serena unleashed a healing ability so extraordinary it left veterinarians speechless and questioning decades of medical science. The desperate Mare's methodical intervention reversed symptoms deemed irreversible, moving the entire hospital staff to tears as they witnessed the impossible unfold before their eyes. Before we continue, don't forget to subscribe to the channel, like the video, and comment where in the world you're watching from. Let's go. The dawn broke over Willow Creek Ranch, painting the sky in hues of pink and gold. Serena, a majestic bay mare with a white star on her forehead, stood watchfully over her newborn foal. The little one, with his chestnut coat gleaming in the morning light, had been born just 2 weeks ago, bringing joy to everyone at the ranch. Emma Davis, the ranch owner, had named him Miracle because his birth had been particularly difficult, yet he and Serena had both pulled through. Emma leaned against the stable door, watching the pair with a smile on her face. At 52, she had dedicated her life to her horses, and each new foal felt like a blessing. But today, something didn't feel right. Miracle seemed unusually lethargic, barely moving from his spot in the corner of the stall. "Hey there, little guy," Emma whispered, entering the stall carefully. Serena's ears perked up, but she didn't move away, trusting Emma completely. The rancher knelt beside the foal, running her hands gently over his body. Miracle's eyes were dull, lacking the bright curiosity he had shown in his first days of life. When Emma touched his skin, she could feel heat radiating from him. "You're burning up, buddy," she murmured, concern etching lines into her weathered face. Emma reached for her phone and called Dr. Mark Reynolds, the local veterinarian who had been caring for her horses for years. "Mark, something's wrong with Miracle. He's running a fever, and he's barely moving. Can you come out to take a look?" Within an hour, Dr. Reynolds arrived at the ranch, his truck kicking up dust as it rolled down the long driveway. Emma met him at the barn, anxiety evident in her hurried movements. "They're in the third stall," she said, leading him inside. Dr. Reynolds approached carefully, always respectful of a mare's protective instincts. Serena watched him with intelligent eyes, but remained calm as he examined her foal. After a thorough check, the veterinarian's expression grew serious. "Emma, I'm concerned about what I'm seeing here," he said, straightening up. "His fever is dangerously high, and I'm noticing some neurological symptoms that worry me. See how he's having trouble coordinating his movements, and the way his muscles seem to twitch involuntarily?" Emma nodded, her heart sinking. "What do you think it is?" "I can't be certain without more tests, but it could be equine neonatal encephalopathy. It's a rare neurological disease that affects newborn foals. If that's what we're dealing with, we need to act quickly." Is it fatal?" Emma's voice cracked as she asked the question she feared most. Dr. Reynolds placed a reassuring hand on her shoulder. "It can be, but not always. The specialists at Valley View Equine Hospital have had success treating cases like this. I recommend we transport him there immediately." Emma agreed without hesitation, despite knowing the considerable expense it would entail. The hospital was nearly 3 hours away, and specialized equine medical care wasn't cheap. But Miracle's life was worth every penny to her. "I'll make the arrangements," Dr. Reynolds said, already dialing the hospital on his phone. "They'll need to prepare for our arrival." While they waited for the transport trailer to be readied, Emma noticed something remarkable. Serena hadn't left her foal's side, but her behavior had changed. She was gently nudging Miracle, encouraging him to stand. When the foal struggled, she positioned herself so that he could lean against her for support. It was as if she understood the urgency of the situation. "Look at that," Emma whispered to Dr. Reynolds. "She knows something's wrong, and she's trying to help him." Dr. Reynolds nodded thoughtfully. Mares have incredible instincts when it comes to their foals. She senses his distress. When the time came to load Miracle into the transport trailer, they faced an unexpected challenge. The foal was too weak to walk the distance, and carrying him would be difficult without causing him additional stress. Emma was about to suggest using a sling when Serena surprised them both by positioning herself next to her foal, lowering her body slightly as if inviting him to use her as support. "Remarkable," Dr. Reynolds murmured as they watched Miracle wobble to his feet, leaning heavily against his mother's side. With Serena carefully matching her pace to her struggling foal, they slowly made their way to the trailer. But when they reached the trailer, another problem arose. Miracle was too weak to climb the ramp. Before Emma or Dr. Reynolds could intervene, Serena gently pushed her muzzle against her foal's hindquarters, providing just enough support to help him make the step up. Once inside, the foal collapsed in exhaustion. "We should sedate him for the journey," Dr. Reynolds suggested, preparing a syringe. "It will reduce his stress and prevent him from hurting himself during transport." Emma nodded in agreement, but as Dr. Reynolds approached with the needle, Serena suddenly placed herself between the veterinarian and her foal, ears pinned back in warning. "Whoa, girl," Emma soothed, stroking the mare's neck. "He's trying to help. We need to get Miracle to the hospital." For a moment it seemed as though Serena might refuse to cooperate. Then, as if understanding Emma's words, she slowly stepped aside, though her eyes never left the needle as Dr. Reynolds administered the sedative to her foal. "She's extraordinary," Dr. Reynolds commented. "I've never seen a mare so in tune with her foal's needs." The next question was whether to bring Serena along. Normally a mare would be left behind during such medical transports, but Dr. Reynolds hesitated. Given their bond and Miracle's condition, separating them might cause more harm than good. The stress could worsen his state. Emma agreed. "Serena comes too. I think Miracle needs her." Loading Serena into the trailer alongside her sedated foal went smoothly, the mare stepping in without hesitation and immediately positioning herself protectively next to Miracle. Emma climbed in as well, determined to accompany them on the journey. As they set off toward Valley View Equine Hospital, Emma sat in the trailer, watching Serena standing vigilantly over her foal. The mare would occasionally lower her head to nuzzle Miracle gently, as if reassuring him that she was there. Despite the sedation, the foal seemed to respond to his mother's presence, his breathing becoming more regular when she was close. "You're something special, Serena," Emma whispered, reaching out to stroke the mare's gleaming coat. "Miracle is lucky to have you fighting for him." The journey seemed endless, the trailer bumping along highways and country roads. Through it all, Serena remained a steadfast guardian, adjusting her stance with each turn to maintain her balance, without stepping on her vulnerable foal. There was an intelligence in her eyes that went beyond normal equine awareness, a determination that matched Emma's own desperate hope. When they finally arrived at Valley View Equine Hospital, a team of specialists was waiting for them. Dr. Catherine Morgan, the head veterinarian, approached the trailer as Emma helped Miracle down the ramp with Serena following closely behind. "This is the foal Dr. Reynolds called about?" Dr. Morgan asked, her experienced eyes already assessing Miracle's condition. "And the mare is his dam? She seems extraordinarily protective." "Yes," Emma replied. "This is Serena and her foal, Miracle. She's been remarkable throughout this ordeal. I don't think he would have made it this far without her." Dr. Morgan nodded thoughtfully. "Well, let's get them both inside. We'll need to run some tests immediately to confirm the diagnosis and begin treatment." As they entered the hospital's clinical area, with its bright lights and unfamiliar smells, Miracle began to tremble, his sedation wearing off. Serena, sensing her foal's distress, nickered softly, a sound so gentle it seemed impossible from such a large animal. The effect on Miracle was immediate. His trembling subsided, and he managed to follow the humans guiding him, drawing strength from his mother's presence. Emma watched, tears forming in her eyes as they approached the examination room. Whatever lay ahead for Miracle, one thing was certain: Serena would not abandon her foal, and neither would Emma. The examination room at Valley View Equine Hospital was spacious and immaculately clean, designed specifically for equine patients. The stark white walls and bright overhead lights created a clinical atmosphere that made Emma's heart race with anxiety. Dr. Morgan and her team moved with practiced efficiency, setting up equipment while speaking in hushed professional tones. "We'll need to run blood work immediately," Dr. Morgan instructed a young veterinary assistant, "and prepare for a spinal tap. If this is EN, we need to confirm it as quickly as possible." Miracle stood trembling in the center of the room, his small body looking even more vulnerable under the harsh lighting. Serena remained close, her large brown eyes watching every movement of the medical staff with intense scrutiny. When a technician approached with a needle to draw blood, Serena tensed visibly but didn't interfere. It was as if she understood that these strangers, despite their intimidating tools, were trying to help her baby. "I've never seen a mare this calm in a hospital setting," Dr. Morgan remarked to Emma. "Usually, we have to separate them because the mothers become too stressed or protective." Emma smiled weakly. "Serena's special. She's always been intelligent. But since Miracle was born, it's like she's developed a whole new level of awareness." Dr. Morgan nodded thoughtfully. "That bond might actually help us. Foals with neurological conditions often respond better to treatment when they're less stressed, and having his mother nearby is clearly keeping him calmer." As they spoke, Miracle suddenly stumbled, his legs buckling beneath him. Before any of the humans could react, Serena moved forward, positioning her body to break his fall. The foal leaned against his mother, breathing heavily. "Let's get him on the examination pad," Dr. Morgan said quickly, gesturing to a padded mat on the floor. "We need to minimize his exertion." With gentle coaxing, they managed to guide Miracle onto the pad. Serena immediately positioned herself beside him, her body forming a protective barrier between her foal and the strange surroundings. A veterinary assistant brought a light blanket, carefully draping it over the foal's trembling body. Dr. Morgan knelt beside Miracle, conducting a thorough neurological examination. She checked his reflexes, eye movements, and muscle responses, her expression growing increasingly concerned. "His symptoms are consistent with ENE," she finally said, looking up at Emma. "The muscle tremors, the coordination issues, the fever, they all point to it. But we need to confirm with laboratory tests and rule out other possibilities." Emma's throat tightened. "What exactly is this disease?" Dr. Reynolds mentioned it's rare. Dr. Morgan stood, removing her latex gloves. "Equine neonatal encephalopathy affects the brain and nervous system of newborn foals. It's caused by a combination of factors. There may be a genetic component, possibly triggered by environmental factors or a virus. The foal's immune system essentially attacks its own nervous tissue." "Is there a cure?" Emma asked, her voice barely above a whisper. "Not a cure exactly," Dr. Morgan replied carefully, "but we've developed treatment protocols that have shown promising results. It involves a combination of immune-suppressing medications, anti-inflammatory drugs, and supportive care. The next 72 hours will be critical." As they spoke, a technician approached with preliminary blood test results. Dr. Morgan reviewed them quickly, her brow furrowing. "His white blood cell count is elevated, and his liver enzymes are concerning," she explained to Emma. "We need to start treatment immediately. I'm going to recommend a combination of corticosteroids to reduce inflammation in his brain and spinal cord, along with targeted immunosuppressants." Emma nodded, trusting the specialist's judgment. "Whatever he needs, cost isn't an issue." "There's something else you should know," Dr. Morgan added, her voice softening. The treatment itself carries risks. The medications will weaken his immune system, making him vulnerable to secondary infections, and the side effects can be significant. Ulcers, weakened bones, metabolic issues. But without treatment, Emma asked, though she already knew the answer. Without treatment, the neurological damage will likely be irreversible. Most untreated foals don't survive past a month. The weight of the decision pressed down on Emma, but there was really no choice to make. Start the treatment, she said firmly. As the medical team prepared the medications, Serena remained vigilant beside her foal. When Dr. Morgan approached with the first injection, the mare watched intently, but made no move to interfere. It was as if she understood that this momentary pain was necessary for her foal's survival. The first medication is a high-dose corticosteroid, Dr. Morgan explained as she administered the injection. We'll follow it with immunoglobulin therapy and supportive fluids. Throughout the procedure, Miracle remained unnaturally still, save for the occasional involuntary muscle twitch. His eyes, though dulled by illness, stayed fixed on his mother. Serena would occasionally lower her head to nuzzle him gently, a gesture that seemed to provide the foal with comfort. We should see some improvement in his symptoms within a few hours if the treatment is working, Dr. Morgan said, but he'll need to stay here for at least a week, possibly longer. Emma nodded, her hand resting on Serena's neck. What about Serena? Can she stay with him? Dr. Morgan hesitated. It's not our usual protocol. The treatment area isn't designed for adult horses. Please, Emma interrupted. I think separating them would cause more harm than good. You said yourself that keeping him calm is important for his recovery. Dr. Morgan considered this, watching as Serena tenderly nuzzled her foal. You're right. We'll make an exception. I'll have the staff prepare the isolation room. It's larger and can accommodate both of them. Relief washed over Emma. Thank you. The next few hours passed in a blur of activity as Miracle received his initial treatments. IV fluids dripped steadily into his small body, and monitors beeped softly, tracking his vital signs. Through it all, Serena remained a steady presence, moving only when the medical staff needed access to her foal. By evening, Miracle had been moved to the isolation room, a spacious area with a padded floor and adjustable lighting. Emma sat on a chair in the corner, exhausted but unwilling to leave. Dr. Morgan had gone home, promising to return early the next morning, leaving Miracle in the capable hands of the night staff. You should get some rest, said Nicole, the overnight veterinary nurse who had introduced herself an hour earlier. There's a small apartment for clients upstairs. We'll call you immediately if there's any change. Emma shook her head. I'd rather stay, if that's all right. Nicole smiled understandingly. Of course, I'll bring you a cot and some blankets. As darkness fell outside, the isolation room was dimmed to a soft glow. Miracle had finally fallen into a fitful sleep, his small body still occasionally twitching with involuntary muscle spasms. Serena stood guard beside him, her large body shielding him from the unfamiliar surroundings. Emma watched them from her cot, marveling at the mare's unwavering devotion. Despite the sterile environment, the strange smells, and the constant interruptions from medical staff, Serena remained calm and focused solely on her foal's well-being. You're his best medicine, Emma whispered to the mare, better than anything they can put in an IV. As if in response, Serena turned her head toward Emma, her intelligent eyes reflecting the soft light. In that moment, a silent understanding passed between woman and horse. They were united in their determination to save Miracle, whatever it took. Outside the isolation room, the hospital quieted for the night. Inside, 3 hearts beat in unison, one fighting for life, one standing guard with fierce maternal love, and one filled with desperate hope. The battle for Miracle's survival had only just begun. Emma awoke with a start. momentarily disoriented by the unfamiliar surroundings. The isolation room was dimly lit, with only the soft glow of monitoring equipment illuminating the space. She checked her watch. 3:24 a.m. She must have dozed off despite her determination to stay awake. Rubbing her eyes, she looked toward Miracle and Serena. What she saw made her breath catch in her throat. Miracle was trembling violently, his small body racked with spasms more severe than before. Serena stood over him, making soft, nickering sounds, her muzzle gently touching his neck. The mare's ears were perked forward, her entire body alert with tension. Emma jumped to her feet, rushing to the intercom button on the wall. "Nurse, something's wrong with Miracle." Nicole appeared within seconds, her experienced eyes quickly assessing the situation. "His temperature is spiking," she said, checking the monitor. 104.2, that's dangerously high. I'm calling Dr. Morgan." As Nicole rushed to the phone, Emma knelt beside Miracle, her heart pounding with fear. The foal's eyes were half closed, his breathing rapid and shallow. She placed a hand on his neck, feeling the heat radiating from his skin. "Hang in there, little one," she whispered, fighting back tears. Serena suddenly began pacing around her foal, her movements deliberate and urgent. She would stop, nudge Miracle gently, then look toward the door as if expecting something. Emma had never seen behavior quite like it. The mare seemed almost human in her awareness. "What is it, girl? What are you trying to tell us?" Emma asked, wishing she could understand. When Nicole returned, Serena immediately focused her attention on the nurse, nickering loudly. "Dr. Morgan is on her way," Nicole reported, preparing a syringe. "She wants us to administer an antipyretic for the fever and increase his IV fluids." As Nicole approached with the syringe, Serena did something remarkable. Instead of standing protectively over her foal as she had done earlier, she stepped aside, creating a clear path to Miracle. It was as if she understood that the medicine was necessary. "That's incredible," Nicole murmured, administering the injection while Emma held Miracle steady. "It's almost like she knows we're trying to help." "She does know," Emma said softly. "I'm convinced of it." After the medication was administered, Nicole adjusted the IV drip and placed cooling packs around Miracle's body to help lower his temperature. Through it all, Serena watched attentively, only returning to her foal's side once the procedures were complete. Dr. Morgan arrived 20 minutes later, her hair hastily pulled back, lines of worry creasing her forehead. She moved quickly to Miracle's side, checking his vital signs and reviewing the charts. "The fever suggests his immune system is in overdrive," she explained, her voice tight with concern. "It's a common complication with ENE, but it's happening sooner than I expected. We need to adjust his medication protocol." As Dr. Morgan spoke, Serena suddenly became agitated, pawing at the ground near Miracle's head. The behavior was so unusual that everyone in the room paused to watch. "What's she doing?" Dr. Morgan asked, puzzled. Emma shook her head. "I don't know. She's been acting strangely all night, like she's trying to communicate something." Dr. Morgan frowned, then bent to examine Miracle more closely, focusing on the area where Serena had been pawing. Her expression changed to one of alarm. "His pupils are uneven," she announced, pulling out a pen light to check his eyes. "That could indicate increasing pressure on his brain. We need to do an ultrasound immediately." A portable ultrasound machine was quickly brought into the room. As Dr. Morgan prepared to scan Miracle's skull, Serena once again stepped back, allowing the doctor clear access while maintaining visual contact with her foal. The image on the ultrasound screen confirmed Dr. Morgan's fears. "There's fluid accumulating around his brain," she said grimly. "The inflammation is causing swelling and increased intracranial pressure. If we don't reduce it quickly, he could suffer permanent brain damage." "What can we do?" Emma asked, her voice breaking. We need to start mannitol therapy immediately to reduce the swelling, and I want to add a stronger anti-inflammatory to his regimen," Dr. Morgan replied, already preparing the necessary medications. "If this doesn't work, we may need to consider more invasive options to relieve the pressure." The next hour was a flurry of activity as the medical team worked to stabilize Miracle. New medications were added to his IV, and his vital signs were continuously monitored. Throughout the crisis, Serena remained a calm presence, only moving when necessary to give the medical staff room to work. By dawn, the emergency had passed. Miracle's fever had dropped to 102.8, still elevated, but no longer life-threatening. The ultrasound showed a slight reduction in the fluid around his brain, and his breathing had become more regular. Dr. Morgan finally stepped back, exhaustion evident in her posture. "He's stable for now," she said, removing her latex gloves. "The next few hours will tell us whether the new treatment protocol is working effectively." Emma nodded, too emotionally drained to speak. She sat down heavily on her cot, watching as Serena gently lowered herself to the floor beside Miracle, careful not to disturb the IV lines and monitoring equipment attached to her foal. The mare stretched her neck across Miracle's back, creating a protective arch over his small body. "I've been a veterinarian for 20 years, Dr. Morgan said quietly, sitting beside Emma, "and I've never seen a mare like Serena. The way she alerted us to the neurological change before we even detected it, it's remarkable." "She's always been special," Emma replied, her voice rough with emotion, "but this is beyond anything I've ever witnessed. It's like she understands exactly what's happening to him and what needs to be done." Dr. Morgan nodded thoughtfully. "Animals sometimes have instincts and perceptions that we don't fully understand. In Serena's case, that maternal bond might be giving her insights that our instruments can't detect." As they spoke, the first rays of morning sunlight filtered through the small window high on the wall, casting a golden glow across the room. Miracle stirred slightly, his eyes fluttering open. Serena immediately raised her head, nickering softly as if to reassure him that she was still there. "Look at that," Emma whispered. "He responds to her voice even in his weakened state." Dr. Morgan watched the interaction with professional interest. "That connection might be our greatest ally in his recovery. Studies have shown that stress can significantly worsen neurological conditions. Having Serena here, keeping him calm, it could make all the difference." After ensuring that Miracle was stable, Dr. Morgan left to check on other patients, promising to return in a few hours. Nicole also departed, replaced by the day shift nurse, a middle-aged man named David who moved with quiet efficiency as he checked Miracle's vital signs and adjusted his medications. Dr. Morgan left instructions to continue the current treatment protocol, he explained to Emma. "She also wants us to start some passive physical therapy to prevent muscle atrophy. Would you like to help with that?" Emma nodded eagerly, grateful for something practical to do. Under David's guidance, she gently moved Miracle's legs through their range of motion, massaging his muscles to improve circulation. Throughout the procedure, Serena watched attentively, occasionally nudging Emma's hand as if offering encouragement. "She understands what we're doing," David remarked, clearly impressed by the mare's behavior. "Most dams would be anxious about us handling their foal this way." "Serena's not most dams," Emma replied with a small smile, the first she had managed since the crisis began. As if to confirm her words, Serena gently nuzzled Miracle's neck, then looked at Emma with those intelligent eyes that seemed to hold so much understanding. In that moment, despite the uncertainty that still hung over Miracle's future, Emma felt a glimmer of hope. With Serena's extraordinary devotion and the skilled care of the medical team, perhaps the little foal would defy the odds after all. The day passed in a strange rhythm of medical procedures and quiet vigils. Miracle's condition remained stable but precarious, like a delicate balance that could tip either way at any moment. Every few hours, a different specialist would visit the isolation room, examining the foal and consulting with Dr. Morgan, who coordinated his complex treatment plan with meticulous attention to detail. By late afternoon, Emma had grown accustomed to the routine. She had called her ranch hand, Miguel, to handle things at Willow Creek while she remained at the hospital. The uncertainty of how long they would need to stay weighed on her, but there was no question of leaving. Miracle needed her, and she needed to be there for both him and Serena. Dr. Morgan entered the isolation room, accompanied by a tall, distinguished man in his 60s whom Emma hadn't met before. "Emma, this is Dr. James Winters," she introduced. "He's our neurology specialist and one of the few veterinarians in the country with extensive experience treating E&E. Emma shook his hand, immediately noting the kindness in his eyes despite his formal demeanor. "Thank you for coming. Does this mean Miracle's condition is worse?" "Not at all," Dr. Winters assured her. "Catherine asked me to consult because I've been collecting data on EN cases for the past decade. Each case teaches us something new about this rare disease." He approached Miracle carefully, mindful of Serena's watchful presence. The mare observed him with her typical intelligence, her ears forward with interest rather than pinned back in warning. It was as if she assessed each new person who entered the room, determining whether they posed a threat to her foal. "Remarkable mare," Dr. Winters commented as he began his examination. "Most dams become increasingly agitated in hospital settings, especially with a sick foal." "Serena's different," Emma replied simply, watching as the neurologist checked Miracle's reflexes and eye responses. Dr. Winters worked methodically, occasionally making notes on his tablet. When he finished the physical examination, he studied the charts and test results with Dr. Morgan. Their hushed conversation lasted several minutes before they turned back to Emma. "The good news is that the intracranial pressure has decreased significantly," Dr. Winters explained. "The mannitol therapy is working as intended. However, I'm concerned about the persistent inflammation in his spinal fluid. The markers we're seeing suggest his immune system is still attacking his nervous tissue despite the immunosuppressants." Emma's heart sank. "What does that mean for his prognosis?" "It means we need to adjust our approach," Dr. Morgan interjected. "Dr. Winters has suggested a plasma exchange therapy that's shown promising results in similar cases." Dr. Winters nodded. "Essentially, we remove some of the foal's blood plasma, which contains the problematic antibodies attacking his nervous system, and replace it with healthy donor plasma. It's more invasive than our current treatments, but it could make a significant difference." "What are the risks?" Emma asked, instinctively moving closer to Miracle and Serena. "The procedure itself carries risks of infection, bleeding, or adverse reactions to the donor plasma," Dr. Winters acknowledged. "But the greater risk at this point is doing nothing. If we can't halt the autoimmune response, the neurological damage may become permanent." Emma looked down at Miracle, who lay quietly on his padded mat, his eyes half closed. Serena stood beside him, her head lowered protectively near his. The decision weighed heavily on Emma, but as before, there wasn't really a choice. "If you think it's our best option, then let's do it," she said firmly. The doctors nodded in agreement. "We'll schedule the procedure for tomorrow morning," Dr. Morgan said. "In the meantime, we'll continue the current protocol and monitor him closely overnight." After they left, Emma sat on the floor beside Miracle, gently stroking his neck. His coat, once gleaming with health, now looked dull, and his small body seemed even more fragile under the hospital blanket. Serena shifted slightly, making room for Emma while maintaining her protective stance over her foal. "You know," Emma said softly to Serena, "when you were pregnant with him, I used to talk to you about all my hopes for this little guy. I imagined him growing up strong, maybe even becoming a champion one day." She blinked back tears. Now I just want him to have a chance at a normal life." Serena lowered her head, gently nuzzling Emma's shoulder in a gesture that felt remarkably like comfort. Emma leaned against the mare, drawing strength from her steady presence. "We'll get through this," she whispered. "All three of us." The evening brought a shift change among the nursing staff. David was replaced by Melissa, a compassionate veterinary nurse with 20 years of experience. She moved about the room quietly, checking Miracle's vitals and adjusting his medications with practiced ease. "You should get some proper rest tonight," Melissa advised Emma. "There's that apartment upstairs and we have your number. I promise we'll call if there's any change." Emma hesitated, looking at Serena. "I don't want to leave them alone." Melissa smiled gently. "They won't be alone. I'll be here all night. And honestly, you'll be more help to them if you're rested." She paused, then added, "Miracle is stable right now, and tomorrow's procedure will be challenging. You'll need your strength." Reluctantly, Emma agreed. After saying goodnight to Miracle and Serena, she made her way to the small apartment upstairs. It was modest but comfortable, with a bed, bathroom, and kitchenette. Despite her exhaustion, sleep proved elusive. Every time she closed her eyes, she saw Miracle's small body trembling with fever, heard the urgent beeping of hospital monitors. Around midnight, unable to rest, she crept back downstairs to check on them. Through the glass panel in the isolation room door, she could see Melissa taking Miracle's temperature while Serena watched attentively. The scene reassured her somewhat, and she was about to return upstairs when something caught her eye. Serena had moved to stand directly over Miracle, her body positioned in a way that seemed deliberate. The mare lowered her head to her foal's neck, then began gently licking him in long, methodical strokes. It wasn't unusual behavior for a dam with her foal, but something about Serena's movements seemed different, more purposeful. Emma watched, fascinated, as Serena continued the grooming with focused intensity. Melissa noticed too, pausing her charting to observe the mare. After several minutes, Melissa approached the door where Emma stood. "I've never seen anything quite like this," she said quietly. "She's been doing this for the past hour, always in the same pattern, from his neck down his spine to his hindquarters." "What do you think it means?" Emma asked. "I'm not sure," Melissa replied thoughtfully, "but his vitals have actually improved since she started. His heart rate is more regular and his temperature has dropped another half degree." Emma felt a surge of hope. She's helping him heal. "Maybe she is," Melissa agreed. "Animals have instincts we don't fully understand. Perhaps she's stimulating his circulation, or maybe the grooming releases endorphins that help reduce inflammation. Or maybe it's just love," Emma finished softly. Melissa smiled. "Whatever it is, it seems to be working. His readings are the best they've been since he arrived." Emma returned to the apartment with a lighter heart, finally able to fall into a deep restorative sleep. In her dreams, she saw Miracle running through green pastures, strong and healthy, with Serena watching proudly from nearby. A vision of hope she desperately wanted to believe could become reality. Dawn broke with a gentle rain pattering against the hospital windows. Emma awoke feeling surprisingly refreshed despite the weight of worry she carried. After a quick shower and change of clothes, she hurried downstairs to the isolation room, eager to check on Miracle before his procedure. She found Dr. Morgan already there, reviewing Melissa's overnight notes with evident interest. "Good morning, Emma," the veterinarian greeted her. "It seems we had some unexpected developments overnight." Melissa mentioned that Serena was grooming Miracle in an unusual way, Emma said, approaching the pair. Miracle was awake, his eyes clearer than they had been the previous day. Serena stood nearby, alert and watchful as always. Yes, and remarkably, his inflammatory markers have decreased significantly, Dr. Morgan explained, showing Emma the latest blood test results. His temperature is almost normal, and the neurological symptoms seem less pronounced this morning. Could it be the medications finally working? Emma asked hopefully. Dr. Morgan tilted her head thoughtfully. Possibly, but the timing coincides more closely with Serena's intervention. Melissa documented that his vital signs improved progressively during and after the grooming sessions. Emma smiled, reaching out to stroke Serena's neck. I've always known she was special, but this is extraordinary. Indeed, Dr. Morgan agreed. I've asked Dr. Winters to review the data before we proceed with the plasma exchange. He should be here shortly. When Dr. Winters arrived 30 minutes later, his usual formal demeanor gave way to genuine surprise as he examined Miracle and reviewed the overnight reports. Fascinating, he murmured, comparing the morning's test results with those from the previous evening. The improvement in his neurological responses is remarkable. Should we still proceed with the plasma exchange? Dr. Morgan asked. Dr. Winters considered this carefully. The improvement is significant, but not enough to guarantee recovery without further intervention. I still recommend proceeding, especially given how quickly E&E can progress. However, he added, glancing at Serena, I'd like to document the mare's behavior more thoroughly. There may be something here worth studying. A team of specialists arrived to prepare for the procedure. They brought specialized equipment into the isolation room, transforming the space into something resembling an operating theater. Throughout the preparations, Serena watched with her characteristic attentiveness, her eyes following each piece of equipment as it was set up. We'll need to move her to another stall during the procedure, one of the technicians said, eyeing Serena uncertainly. There won't be enough space and we can't risk contamination. Emma's heart sank. She feared Serena's reaction to being separated from Miracle, especially during such a critical time. Is there any way she could stay? She's been so calm and helpful. Dr. Morgan and Dr. Winters exchanged glances. It's not standard protocol, Dr. Morgan began, but Dr. Winters interrupted. Given the unique circumstances and the mare's unusual influence on the foal's condition, I think we should consider making an exception, he said. We could position her at the far end of the room with proper barriers in place. After some discussion, a compromise was reached. A temporary partition would be set up, allowing Serena to remain in the room, but separated from the sterile field where the procedure would take place. Emma would stay with Serena, keeping her calm during the treatment. As the team made final preparations, Emma led Serena to the designated area behind the partition. She expected resistance from the mare, anticipating that Serena would be distressed at being separated from her foal. To her surprise, Serena followed without hesitation, as if understanding the necessity of the arrangement. She continues to amaze me, Dr. Winters commented, observing Serena's cooperative behavior. It's almost as if she comprehends what we're trying to accomplish here. The plasma exchange procedure began at precisely 10 a.m. Miracle was sedated lightly to keep him still during the treatment. Special catheters were inserted into his jugular vein, connecting him to the apheresis machine that would separate his blood components, remove the problematic plasma, and replace it with healthy donor plasma. From behind the partition, Emma could see the medical team working with focused precision. Serena stood beside her, surprisingly calm but alert, her gaze fixed on the gap in the partition where she could glimpse her foal. Occasionally she would make soft nickering sounds as if reassuring Miracle that she was still there. "You're doing great, girl," Emma whispered, stroking Serena's neck. "He's in good hands." The procedure progressed smoothly for the first hour. Miracle remained stable, his vital signs carefully monitored as his blood circulated through the machine. Dr. Winters supervised every step, his experienced eyes missing nothing as he occasionally adjusted settings or gave quiet instructions to the team. Then, without warning, one of the monitors began to emit a high-pitched alarm. "Blood pressure dropping," a technician announced, her voice tense, heart rate increasing. "He's having a reaction to the donor plasma," Dr. Winters said sharply. "Push 10 cc of epinephrine and slow the return rate." The team moved with practiced urgency, administering medications and adjusting the equipment. Emma watched in helpless fear as the monitors continued to display concerning readings. Beside her, Serena suddenly became agitated, pawing at the ground and tossing her head. "Serena, it's okay." Emma tried to soothe her, but the mare's distress only increased. She pushed against the partition, not aggressively but with determined purpose. "Emma, can you keep her back?" Dr. Morgan called, glancing over with concern. "I'm trying," Emma replied, but Serena was not to be deterred. With a final firm push, she dislodged the lightweight partition enough to create a gap, then slipped through it before Emma could stop her. The medical team froze, uncertain how to respond to the large animals suddenly in their midst. But Serena didn't charge toward her foal as they feared. Instead, she approached calmly, stopping a respectful distance from the procedure area. There, she lowered her head and began making a deep, rhythmic humming sound unlike anything Emma had heard before. "Don't move," Dr. Winters instructed the team quietly. "Let's see what happens." The strange, resonant sound continued as Serena maintained her position. To everyone's astonishment, the monitors began to show improvement. Miracle's heart rate gradually stabilized, and his blood pressure rose to safer levels. "This is extraordinary," Dr. Winters murmured, watching the readings with disbelief. "His vitals are normalizing without additional medication." For several minutes, no one in the room moved or spoke. They simply watched in amazement as Serena's unusual vocalization seemed to stabilize her foal. When Miracle was finally out of danger, Dr. Winters gave the signal to continue the procedure, but at a slower pace. "We'll allow her to stay," he decided, his scientific curiosity evidently overcoming his adherence to protocol. "But monitor her closely and be prepared to intervene if necessary." Emma moved to stand beside Serena, placing a comforting hand on her neck. The mare acknowledged her with a gentle nudge but kept her focus on Miracle, continuing her soft humming whenever the monitors showed the slightest change in his condition. The remainder of the procedure proceeded without incident. When it was finally complete, nearly 3 hours after it began, the team carefully removed the catheters and applied pressure bandages to Miracle's neck. The foal was still sedated but breathing steadily, his vital signs stable. "We've completed the plasma exchange successfully," Dr. Winters announced, removing his surgical mask. "Now we wait to see how he responds over the next 24 to 48 hours. As the team cleaned up and removed the equipment, Serena was finally allowed to return to her full side. She approached slowly, lowering her head to gently nuzzle Miracle's neck just above the bandage. Her touch was so tender, so careful, that several members of the medical team paused to watch. "In 25 years of veterinary medicine," Dr. Winters said quietly to Emma, "I've never witnessed anything quite like this. She very likely saved his life today." Emma nodded, too overcome with emotion to speak. In the middle of a high-tech medical facility, surrounded by the most advanced treatments veterinary science could offer, it was the primal bond between mother and child that had made the difference between life and death. The hours following the plasma exchange procedure were critical. Miracle remained sedated throughout the afternoon, his body processing the foreign plasma now circulating in his system. Emma stayed in the isolation room, alternating between sitting beside the foal's mat and stepping outside for brief breaks when the medical staff needed to perform checks or adjust medications. Serena never left her position. Even when offered water or feed, she would only turn her head briefly toward the bucket, taking quick sips or bites before returning her attention to Miracle. Her vigilance was unwavering, her dedication absolute. By evening, Miracle began to stir. His sedation was wearing off gradually, allowing the team to assess his neurological responses. Dr. Morgan carefully lifted one of his eyelids, shining a penlight to check his pupillary response. "Good," she murmured, noting the equal constriction in both pupils. "That's a positive sign." Emma watched anxiously from nearby. "Is he improving?" "It's too early to make definitive statements," Dr. Morgan replied cautiously. "But some of his reflexes are stronger than they were before the procedure. His inflammatory markers are also continuing to decrease, which is exactly what we were hoping for." As night fell, a new nurse named Rachel took over, bringing a fresh energy to the room. She was younger than the others, with a cheerful disposition that somehow didn't feel out of place despite the serious circumstances. "I've been reading about your case in the staff notes," she told Emma as she checked Miracle's IV lines. "Everyone's talking about Serena and her unusual behaviors. Some of the technicians are calling her the Miracle Mare." Emma smiled tiredly. "It's a fitting nickname, though I'd say Miracle is working pretty hard himself." "Of course," Rachel agreed, gently stroking the foal's neck. "He's a fighter, but having his mom's support seems to be making all the difference." Around midnight, Emma was dozing in a chair when she was awakened by a soft nickering sound. Opening her eyes, she saw Serena engaged in the same methodical grooming behavior that Melissa had documented the previous night. The mare was licking Miracle's neck and spine in long, deliberate strokes, occasionally pausing to make that unusual humming sound that had stabilized him during the procedure. Rachel, who had been updating charts at the small desk in the corner, came over to watch. "This is what everyone's been talking about," she whispered, careful not to disturb Serena's rhythm. "It's almost like a massage technique." Emma nodded. "Dr. Winters wants to document it. He thinks there might be something medically significant about it." "I wouldn't be surprised," Rachel replied. "Animals often know things we don't." She hesitated, then added, "My grandmother was a traditional healer in her community. She always said that mothers have healing wisdom in their hands, a knowledge that comes from the heart, not from books." As if to confirm Rachel's words, the monitors tracking Miracle's vital signs showed subtle improvements: a slightly stronger heart rate, more regular breathing patterns, improved blood oxygen levels. The changes were small but consistent, occurring in tandem with Serena's ministrations. Rachel documented everything carefully, taking photos with a hospital tablet and making detailed notes about the timing and nature of Serena's behaviors and Miracle's responses. "Dr. Winters will want to see all of this," she explained. "He's particularly interested in the vocalization patterns." The night passed quietly, with Miracle showing gradual signs of increased awareness. By morning, he was fully awake, his eyes clearer and more focused than they had been since his arrival at the hospital. When Dr. Morgan arrived for her morning rounds, she found him attempting to lift his head, a small but significant improvement in his motor control. "This is encouraging," she said, conducting a thorough neurological examination. "The plasma exchange appears to have helped reduce the autoimmune response, and his body is beginning to heal." Emma felt a surge of hope. "Does this mean he's going to recover?" Dr. Morgan smiled gently. "We need to be cautious about making predictions with ENE. Recovery is typically a long process with ups and downs along the way. But yes, these are positive developments." Dr. Winters arrived shortly after, keen to review the overnight documentation. Rachel walked him through her observations of Serena's behaviors, showing him the photos and videos she had captured. "Fascinating," he muttered, studying the footage of Serena's grooming pattern. "The rhythm is remarkably consistent, and it seems to focus on areas along the central nervous system." He looked up at Emma. "Has she always done this type of grooming with her foal?" Emma shook her head. No, this is new. She's always been attentive, but this specific behavior started here at the hospital. Dr. Winters turned to Dr. Morgan. I'd like to run some additional tests today. Non-invasive ones, he added quickly, seeing Emma's concerned expression. Just some thermal imaging and surface EMG to see if we can detect any physiological changes during these grooming sessions. The morning progressed with a series of gentle tests designed to document the effects of Serena's interventions. Thermal cameras showed increased blood flow to the areas she focused on, while surface electromyography detected subtle changes in Miracle's muscle activity during her humming vocalizations. It's as if she's inducing a specific frequency response in his nervous system, Dr. Winters explained, reviewing the EMG readings. Similar to how certain sound frequencies can promote healing or relaxation in humans. Around noon, Emma stepped out briefly to call Miguel for an update on the ranch. When she returned 15 minutes later, she found an unexpected flurry of activity in the isolation room. Several technicians were crowded around Miracle, and Dr. Morgan was issuing rapid instructions. What's happening? Emma asked, her heart racing with sudden fear. Rachel approached quickly. Miracle tried to stand up on his own. He managed to get his front legs under him but collapsed. Dr. Morgan is checking to make sure he didn't injure himself. Is this a setback? Emma asked anxiously. Actually, it's the opposite, Rachel explained with a smile. The fact that he tried to stand is a very positive sign neurologically. It means his motor pathways are functioning better than we expected at this stage. Dr. Morgan just wants to make sure he didn't strain anything since his muscles are still weak. Relief washed over Emma as she watched the examination continue. Serena stood nearby, alert but calm, as if she understood that this development was a step forward rather than a cause for alarm. After confirming that Miracle hadn't sustained any injuries, Dr. Morgan approached Emma with an encouraging smile. His attempt to stand is remarkably promising. Most foals with ENE take much longer to regain this level of motor function. So he's improving faster than expected? Emma asked hopefully. Yes, which raises an interesting question, Dr. Morgan replied, glancing at Serena. How much of his accelerated recovery is due to our medical interventions, and how much might be attributed to his mother's unique care? Dr. Winters, who had been observing from nearby, joined the conversation. I believe we're witnessing a powerful synergy between modern veterinary medicine and something far more ancient, a mother's instinctive healing abilities. He looked at Serena with newfound respect. Perhaps instead of viewing these as separate approaches, we should consider how they might complement each other. As the day progressed, a new treatment schedule was implemented, one that deliberately incorporated periods for Serena's interventions between the medical procedures. The hospital staff began working around the mare's rhythms, noting that Miracle's responses to treatment seemed enhanced when they followed Serena's grooming sessions. By late afternoon, Emma noticed something she hadn't seen since before Miracle fell ill. A spark of the playful spirit that had characterized him in his first days of life. Though still weak and unable to stand independently, he began showing interest in his surroundings, turning his head to follow movements and making soft, nickering sounds in response to Serena's gentle nudges. It was a small change, but to Emma, it represented something profound. The return of her little Miracle's personality, emerging from beneath the shadow of illness that had nearly claimed him. The fourth day, at Valley View Equine Hospital, brought an unexpected visitor. Emma was helping Rachel change Miracle's bedding when Dr. Winters entered the isolation room, accompanied by an elegant woman in her 50s, dressed in a tailored suit with a stethoscope around her neck. Emma, this is Dr. Eleanor Chambers, Dr. Winters introduced. She's the hospital director and a specialist in equine rehabilitation. Emma shook the woman's hand, immediately noticing her warm, appraising gaze. It's nice to meet you, she said. I've been meaning to thank you for allowing Serena to stay with Miracle. I know it's not standard protocol." Dr. Chambers smiled. "When cases challenge our protocols, it's often because they have something important to teach us." She approached Miracle carefully, acknowledging Serena with a respectful nod before kneeling to examine the foal. "James has been keeping me updated on your remarkable case. I had to see for myself." She conducted a thorough examination, her experienced hands moving with gentle precision as she checked Miracle's muscle tone and reflexes. "Impressive improvement for a foal with E&E," she commented, rising to her feet, especially considering the severity of his initial presentation. "We believe Serena's interventions have played a significant role," Dr. Winters explained, gesturing toward the mare. "The timing of his improvements correlates strongly with her specific behaviors." Dr. Chambers looked at Serena with renewed interest. "So I've heard. The staff is calling her the Miracle Mare, I believe." She turned to Emma. "Has she always had this special connection with her foal?" "They've been close from the beginning," Emma replied. "But this level of healing behavior, I guess you could call it, that's new. It's like she developed these skills specifically to help him through this illness." Dr. Chambers nodded thoughtfully. "Maternal instincts are powerful forces in nature. Throughout my career, I've observed countless examples of dams seeming to know exactly what their offspring need sometimes before we veterinarians do." She paused, watching as Serena gently nuzzled Miracle's neck. "But what you're describing goes beyond typical maternal care." "We've been documenting everything," Dr. Morgan said, joining the conversation. "The specific grooming patterns, the vocalizations, the timing of her interventions. There are measurable physiological responses in the foal that correspond with her actions." "I'd like to review all of that data," Dr. Chambers said, "and I have a proposal. We've recently established a new rehabilitation wing specifically designed for young foals recovering from neurological conditions. It includes padded flooring, assistive standing equipment, and a hydrotherapy pool. I think Miracle might be an excellent candidate for transfer there, perhaps as early as tomorrow." Emma's heart leapt at the thought of Miracle progressing to rehabilitation. "That sounds wonderful, but what about Serena? Would she be able to stay with him?" "Actually, that's the most intriguing part of my proposal," Dr. Chambers replied with a smile. "Given what we're observing about Serena's positive influence, I'd like to formally incorporate her into Miracle's rehabilitation program. We would document her natural interventions and integrate them with our standard therapies, creating a truly holistic approach." Dr. Winters looked surprised but pleased. "That's quite innovative, Eleanor. The board has approved this?" "I presented the case to them this morning," she confirmed. "They're intrigued by the potential research implications. If we can better understand how Serena's behaviors are affecting Miracle's recovery, it might inform new approaches to equine rehabilitation more broadly." The prospect of moving to a facility designed for recovery rather than critical care filled Emma with hope. After the doctors left to make arrangements, she sat beside Miracle's mat, gently stroking his neck while Serena stood nearby. "Did you hear that, little one? You're doing so well. They're moving you to rehabilitation." She looked up at Serena. "And it's largely thanks to your mama. She's showing those doctors a thing or two about healing." That afternoon, Miracle achieved another milestone when he successfully stood with minimal assistance. Rachel and another technician supported him gently as he wobbled on uncertain legs, his body remembering movements that had once been instinctive before illness had compromised his nervous system. "Look at that balance," Rachel encouraged as Miracle managed to remain standing for nearly 2 minutes. "That's amazing progress." Serena watched the exercise with keen attention, nickering softly as if offering encouragement. When Miracle finally tired and was lowered back to his mat, She immediately began her now familiar grooming routine, focusing particularly on his legs and spine. "She's like a physical therapist," Rachel observed, targeting exactly the muscle groups he just used. By evening, preparations for the move to the rehabilitation wing were complete. Dr. Morgan visited to explain what Emma could expect in the coming days. "The rehabilitation program will be more active," she explained. "Daily therapy sessions gradually increasing in duration and intensity as Miracle builds strength. We'll be working on standing, walking, coordination, and eventually more complex movements." "What about the E&E?" Emma asked. "Is he still at risk for complications?" "We'll continue monitoring his neurological function and inflammatory markers," Dr. Morgan assured her. "The immunosuppressive medications will be gradually tapered, but we'll watch carefully for any signs of relapse. The good news is that his latest test results show continued improvement. The autoimmune response appears to be subsiding." "And the long-term prognosis?" Emma asked, voicing the question that had lingered in her mind since they had arrived at the hospital. Dr. Morgan smiled. "It's still early, but given his remarkable progress so far, I'm increasingly optimistic. Miracle is defying our usual timelines for recovery from E&E. If he continues on this trajectory, he has an excellent chance of regaining normal or near-normal function." The news brought tears to Emma's eyes. After days of uncertainty and fear, the possibility of Miracle returning to Willow Creek Ranch as a healthy, normal foal seemed within reach. She thanked Dr. Morgan, then turned to Serena. "Did you hear that, girl? You're helping him beat this thing." The night passed peacefully, with Miracle sleeping more soundly than he had since his arrival. Emma, too, slept better, the weight of constant anxiety finally beginning to lift from her shoulders. In the morning, they would move to the rehabilitation wing, a physical transition that represented a profound shift in Miracle's journey from fighting for survival to recovering and rebuilding. Dawn arrived, with a burst of golden sunlight streaming through the small window of the isolation room. Emma awoke to find Miracle already alert, his eyes brighter and more engaged than they had been in days. Even more remarkably, he was attempting to nurse from Serena, who stood patiently as he found his way to her udder with only slight unsteadiness. "Well, look at you," Emma said softly, not wanting to interrupt the natural moment between mother and foal. This basic behavior, a foal nursing from his dam, was something most horse owners took for granted. But for Miracle, it represented a significant neurological achievement, requiring coordination, balance, and strength that had been compromised by his illness. When Rachel arrived to prepare them for the move, she paused in the doorway, smiling at the scene. "That's exactly what we want to see," she said. "His instincts are returning." A team arrived with a specialized transport gurney designed for moving young foals safely. To everyone's surprise, Miracle required less assistance than anticipated, managing to walk the short distance with only minimal support. Serena followed close behind, watching every step with maternal vigilance. The rehabilitation wing was located in a newer section of the hospital, with large windows allowing natural light to flood the spaces. Miracle's new room was twice the size of the isolation unit, with special cushioned flooring and a variety of therapy equipment organized neatly along one wall. Most importantly, there was ample space for Serena to remain comfortably with her foal. "This is perfect," Emma said, taking in the thoughtfully designed environment. For the first time since their arrival at Valley View, she felt a sense of true optimism blooming in her chest. They had moved from crisis to recovery, from desperate hope to genuine progress. The rehabilitation wing operated with a different rhythm than the critical care unit. Instead of the constant monitoring and medical interventions that had dominated their first days at the hospital, Miracle's care now followed a structured therapy schedule interspersed with rest periods. Each morning began with a comprehensive assessment by Dr. Chambers or one of her rehabilitation specialists. followed by a tailored set of exercises designed to strengthen Miracle's recovering nervous system. Emma quickly adapted to the new routine, becoming an active participant in Miracle's therapy sessions. Under the guidance of Alex, a dedicated equine physical therapist, she learned how to support Miracle's weight properly during standing exercises and how to assist with the passive range of motion activities that kept his muscles engaged. The goal is to remind his body of what normal movement feels like, Alex explained during their first full day in rehabilitation. His brain and nerves are healing, but they need constant reinforcement to rebuild those pathways correctly. The most remarkable aspect of the rehabilitation program was how seamlessly Serena had been integrated into it. The medical team had created a schedule that deliberately alternated between formal therapy sessions and periods when Serena was encouraged to engage in her natural healing behaviors with Miracle. We're essentially conducting a real-time study of interspecies rehabilitation techniques, Dr. Chambers explained when she visited on the second day. Serena's instinctive approaches alongside our science-based methods. So far, the combination appears more effective than either would be alone. By the end of their first week in rehabilitation, Miracle's progress was undeniable. He could now stand unassisted for nearly 10 minutes at a time, and his first tentative steps without support had brought tears to Emma's eyes. The tremors that had plagued his limbs were diminishing, and his coordination improved daily. His brain is making new connections, Dr. Morgan explained during one of her regular visits, essentially rewiring itself around the damaged areas. Young foals have remarkable neuroplasticity. Their brains can adapt and compensate in ways adult horses can't. On the 8th day of rehabilitation, Dr. Winters arrived with a small team and sophisticated recording equipment. "With your permission," he said to Emma, "we'd like to document one of Serena's complete healing sessions with high-definition video and biometric sensors attached to Miracle. The hospital board has approved a formal research study based on what we've been observing." Emma readily agreed, curious herself to better understand the science behind what Serena was doing instinctively. The team worked quietly, attaching small, non-invasive sensors to Miracle's body to monitor his heart rate, muscle activity, and even brain waves during Serena's ministrations. What they captured that afternoon astonished even the most skeptical members of the medical team. As Serena began her methodical grooming along Miracle's spine, the monitors showed immediate changes in his physiological state. His heart rate stabilized, muscle tension decreased, and his brain activity shifted to patterns typically associated with accelerated healing and neural integration. "It's like she's inducing a state of deep healing," Dr. Winters said, watching the readouts with fascination. "Similar to what we try to achieve with certain medications and therapies, but she's doing it naturally, through touch and sound." Most remarkable was when Serena produced her special humming vocalization, the sound that had mysteriously stabilized Miracle during his plasma exchange procedure. The sensors detected synchronization between the frequency of her sound and Miracle's brainwaves, a phenomenon that Dr. Winters described as auditory entrainment. "She's essentially creating a frequency that his nervous system responds to," he explained to Emma afterward. "It's like a tuning fork that helps his neural patterns reset to a healthier rhythm." The formal documentation of Serena's healing abilities created a buzz throughout the hospital. Staff members who had previously been skeptical now stopped by the rehabilitation room to witness the Miracle Mare in action. Dr. Chambers began organizing a multidisciplinary team to analyze the growing body of data they were collecting. "What we're learning here could potentially transform equine rehabilitation protocols," she told Emma one afternoon. "Serena is showing us aspects of healing that our medical training never taught us." As Miracle continued to improve, Emma found herself reflecting on the journey that had brought them to this point. What had begun as a terrifying crisis, a beloved foal struck down by a rare disease, was transforming into something unexpected, a profound lesson in the healing power of maternal love and the remarkable harmony that could exist between instinctive animal wisdom and human medical science. On the morning of their 10th day in rehabilitation, Emma arrived to find Alex already working with Miracle on a new therapy tool, a specially designed sling system that allowed the foal to practice walking movements while supporting part of his weight. "We call it our moon walker," Alex explained with a grin. "It lets him experience the motion of walking without the full strain of supporting his body weight, builds confidence and muscle memory." Miracle seemed to enjoy the new equipment, walking with more fluidity than Emma had seen since his illness began. Serena watched attentively from nearby, occasionally approaching to check on her foal before stepping back to give the therapist space to work. "She's become quite the team player," Alex commented, adjusting the sling height. "Most mares would be interfering constantly, but she seems to understand when to step in and when to let us do our part." After the morning therapy session, Emma took a rare break to call Miguel and check on things at Willow Creek Ranch. As she stepped into the hallway, she overheard two veterinarians talking around the corner. "Most remarkable case I've seen," one was saying. "The foal had textbook EN, severe presentation. By all statistical probabilities, he should have had permanent neurological damage if he survived at all." "And now?" asked the second voice. "Dr. Chambers says he's on track for a full recovery. They're documenting everything about the mare's behaviors. Apparently there's talk of publishing a paper in the Journal of Veterinary Medicine." Emma smiled to herself, feeling a surge of pride for Serena. The mare, who had once been just a beloved companion, was now potentially changing how the veterinary world understood animal healing. When she returned to the rehabilitation room, she found Dr. Morgan conducting Miracle's afternoon assessment. The veterinarian looked up with a bright smile. "Perfect timing, Emma. I was just about to come find you. I have some excellent news." Emma's heart quickened. "What is it?" "Miracle's latest blood work and neurological assessments show remarkable improvement," Dr. Morgan explained. "The inflammatory markers are now within normal range, and his neurological function has recovered to approximately 80% of what we would expect in a healthy foal his age." "That's wonderful," Emma said, kneeling to stroke Miracle's neck. The foal nudged her hand playfully, another sign of his returning personality. "There's more," Dr. Morgan continued. "Given his progress, we believe he's reached a point where he could continue his rehabilitation at home, with regular visits from a traveling therapist. In other words, Emma, you can start preparing to take them back to Willow Creek." The news hit Emma like a wave of pure joy. After nearly 2 weeks of living in the hospital environment, the thought of returning to the ranch with both Miracle and Serena seemed almost too good to be true. "When?" she asked, her voice thick with emotion. "We'd like to keep him through the weekend for final assessments and to create a home therapy plan," Dr. Morgan replied. "But if all continues well, you could take them home on Monday." Emma turned to Serena, who stood watching them as if she understood every word. "Did you hear that, girl? We're going home soon." Serena nickered softly in response, then lowered her head to nuzzle Miracle gently. The gesture seemed to contain both maternal pride and protection, a silent promise that she would continue to guard her foal's health long after they left the hospital's care. The final days at Valley View Equine Hospital took on a celebratory atmosphere. News of Miracle's impending discharge spread throughout the facility, bringing a steady stream of staff members who wanted to say goodbye to the remarkable foal and his extraordinary mother. From the housekeeping staff who had quietly maintained their space to the specialists who had guided his treatment, everyone seemed invested in Miracle's success story. "I've never seen anything quite like this," Rachel commented on Saturday morning as she helped Emma gather the various medications and supplies they would need at home. Usually when we discharge patients, it's just the attending vet and maybe a nurse, but half the hospital keeps finding excuses to stop by. Emma smiled, watching as yet another technician, one she didn't even recognize, peeked into the room to wave at Miracle. I think Serena's become something of a celebrity around here. It's more than that, Rachel replied thoughtfully. What happened with Miracle and Serena? It's given everyone hope. In a profession where we see a lot of heartbreak, their story reminds us why we do this work. The weekend was filled with preparations for the transition home. Dr. Chambers and her team created a comprehensive rehabilitation plan with exercises, medication schedules, and monitoring protocols that Emma would need to follow at Willow Creek. Alex spent several hours teaching Emma more advanced therapy techniques, ensuring she felt confident performing them without supervision. Remember, the key with neurological recovery is consistency, he explained as they practiced a particular stretching sequence. Daily therapy, even for short sessions, is more beneficial than intensive work every few days. Dr. Winters stopped by on Saturday afternoon, carrying a sleek tablet and a small device that looked like a specialized microphone. Before you leave, I wanted to give you something, he said, handing the equipment to Emma. What's this? She asked, examining the items curiously. The tablet contains all the data we've collected on Serena's healing behaviors, the frequencies, patterns, and physiological responses we've documented, he explained. The audio device is a specialized recorder that can capture and analyze the specific frequencies of her vocalizations. I thought you might want to continue the documentation at home. Emma was touched by the gesture. You really think what she does is that significant? Emma, what we've witnessed here could influence veterinary rehabilitation approaches for years to come, Dr. Winters replied seriously. Serena has demonstrated healing techniques that we're only beginning to understand. The more data we can gather, the more we might be able to help other foals in the future. The idea that Serena's instinctive behaviors might eventually help other horses facing similar challenges filled Emma with pride. She promised Dr. Winters she would continue recording Serena's interactions with Miracle and send the data regularly. On Sunday morning, Dr. Morgan conducted Miracle's final comprehensive evaluation. She methodically checked every aspect of his neurological function, from simple reflexes to complex coordination tasks. Emma watched anxiously, holding her breath as Miracle performed each test. Well, Dr. Morgan said finally, setting down her examination tools with a satisfied smile, I'm pleased to confirm that Miracle is officially cleared for discharge tomorrow morning. His recovery has exceeded our most optimistic projections. Relief and joy washed over Emma. So he's going to be okay? Really okay? His progress has been remarkable, Dr. Morgan confirmed. While he'll need continued therapy and monitoring, I believe he has an excellent chance of developing normally from this point forward. What about long-term effects? Emma asked, the question that had lingered in the back of her mind throughout the ordeal. Will there be permanent damage? Dr. Morgan considered the question carefully. It's difficult to make absolute predictions with neurological conditions, especially in young animals. Miracle may always have some subtle differences in his gait or coordination compared to foals who never experienced EN, but given the extent of his recovery so far, I expect any lingering effects to be minor, perhaps noticeable only to someone who knows him well. The assessment felt like a miracle itself, so much more than Emma had dared to hope for in those first terrifying days of Miracle's illness. She knelt beside the foal, who was now standing steadily on his own, and wrapped her arms gently around his neck. You did it, little warrior, she whispered. You fought so hard. Miracle nickered softly in response, nudging her shoulder with his muzzle in a playful gesture that would have been unimaginable just 2 weeks earlier. Nearby, Serena watched the interaction with those intelligent eyes that seemed to hold so much wisdom. Emma stood and approached the mare, wrapping her arms around Serena's strong neck. "And you," she said, her voice thick with emotion. "You amazing, brilliant girl. You never gave up on him." That evening, Dr. Chambers hosted a small gathering in the hospital's conference room, a combination farewell party and informal celebration of Miracle's recovery. Staff members from various departments attended, sharing stories about their experiences with the remarkable Mare and Foal. "In my 30 years of veterinary medicine," Dr. Chambers said, raising a coffee cup and a toast, "I've seen many cases that defied the odds, but few have taught us as much as Miracle and Serena. They've reminded us that healing happens through many channels. Some we understand scientifically and some we're still discovering." Emma, touched by the gesture, found herself suddenly emotional. "I don't know how to thank you all," she said, looking around at the assembled medical team. "When we arrived here, I was terrified I was going to lose him. What you've done—" "What we did was important," Dr. Morgan interjected gently. "But let's be honest, Serena was the real hero of this story. She showed us a side of healing we might have overlooked." Heads nodded around the room in acknowledgement. Even the most scientifically minded among them had been profoundly affected by witnessing Serena's devotion and apparent healing abilities. "I think what we're really celebrating," Dr. Winters added thoughtfully, "is a beautiful partnership between veterinary medicine and nature's own wisdom. Neither alone would have been enough to save Miracle." When Emma returned to the rehabilitation room that night, she found Serena and Miracle resting peacefully. The foal was curled up on his cushioned mat, sleeping deeply, while Serena stood nearby in a light doze, ever vigilant. Tomorrow they would leave this place that had become a second home, returning to the wide-open spaces of Willow Creek Ranch. Emma sat quietly in the corner, taking in the scene. The sterile hospital room with its medical equipment and monitors had been transformed by the presence of these two remarkable beings. What had begun as a clinical space was now infused with something profound, a testament to the healing power of maternal love. In the soft glow of the night lighting, Emma allowed herself to fully absorb the miracle they had witnessed. Miracle had not simply survived against the odds, he had thrived, his recovery accelerated by the extraordinary bond with his mother, and Serena had revealed abilities that challenged conventional understanding of animal cognition and healing. As she prepared for their final night at Valley View, Emma felt a deep sense of gratitude wash over her. Beyond the joy of Miracle's recovery was a profound appreciation for the journey itself, the lessons learned, the bonds strengthened, and the reminder that sometimes the most powerful medicine comes not from science but from love. Morning would bring the excitement of returning home, of introducing Miracle to the familiar pastures of Willow Creek, of beginning the next chapter in his remarkable story. But for now, in the quiet of this last hospital night, Emma simply savored the precious gift of his healing and the extraordinary Mare who had made it possible. The morning of discharge dawned bright and clear, as if nature itself was celebrating Miracle's recovery. Emma arrived early at the hospital, eager to complete the final paperwork and begin the journey home. She found Dr. Morgan already in the rehabilitation room, conducting one last examination of Miracle while Serena watched attentively. "Everything looks excellent," Dr. Morgan announced, straightening up with a satisfied smile. "He's ready to go home." The specialized transport trailer arrived mid-morning. Unlike the tense, urgent journey that had brought them to Valley View 2 weeks earlier, this departure was marked by optimism and hope. Miracle walked into the trailer with only minimal assistance, his steps growing steadier with each passing day. Serena followed calmly, positioning herself beside her foal for the journey home. As Emma prepared to leave, the hospital staff gathered in the hallway for a final farewell. Many had tears in their eyes, including the usually composed Dr. Chambers. "We'll be checking in regularly, Doctor," Morgan assured Emma as they said goodbye. "And remember, the traveling therapist will visit 3 times a week to supplement your daily exercises with Miracle." "I can't thank you enough," Emma said, embracing the veterinarian who had guided them through the darkest days of Miracle's illness. "You gave him a chance when things seemed hopeless." "We all played our parts," Dr. Morgan replied warmly. "But Serena deserves the most credit. She taught us all something valuable about healing." The journey back to Willow Creek Ranch seemed to pass in a blur of anticipation. Emma found herself chattering excitedly to Miracle and Serena through the trailer's observation window, describing all the familiar places they would soon see again. After the confined environment of the hospital, she could hardly wait to watch Miracle experience the open pastures of home. When they finally turned onto the long driveway leading to the ranch, Emma felt a lump form in her throat. Miguel and several neighboring ranchers had hung a hand-painted banner across the barn entrance. "Welcome home, Miracle and Serena." The simple gesture of community support touched her deeply. "Look, we're home," she called to her precious cargo as they approached the barn. Miguel was waiting, his weathered face breaking into a broad smile as Emma parked the truck and trailer. "The conquering heroes return," he said, helping her lower the trailer ramp. "How's our little fighter doing?" "See for yourself," Emma replied proudly as Miracle appeared at the trailer entrance. The foal paused, sniffing the familiar air of the ranch, his ears perked forward with interest. Then, with more confidence than Emma had expected, he navigated the ramp and took his first steps back on home soil. Serena followed close behind, her posture relaxed yet vigilant as she surveyed their familiar surroundings. When Miracle hesitated, momentarily overwhelmed by the open space after weeks in the hospital, she gently nudged him forward, her presence providing the reassurance he needed. "Incredible," Miguel murmured, watching the interaction. "From what you told me on the phone, I wasn't sure what to expect, but he looks almost normal." "It's been an amazing recovery," Emma agreed. "The doctors call it unprecedented for a case as severe as his, and they credit much of it to Serena's care." They had prepared a special enclosure for Miracle's continued rehabilitation, a small paddock with soft footing and shelter from the elements, where he could gradually reacclimate to outdoor living while remaining protected. As they led Mare and Foal to their new space, Emma noticed how Miracle's steps grew more confident with each passing moment, as if the familiar sights and smells of home were awakening something deep within him. The first few days at Willow Creek established a new routine. Each morning began with the therapy regimen prescribed by the hospital team, followed by gradually increasing periods of supervised freedom in the paddock. Emma diligently documented everything: Miracle's progress, Serena's continued healing behaviors, and the subtle changes in their interactions as the foal grew stronger. A week after their return, Jennifer Walsh, the traveling therapist from Valley View, arrived for her first session. She watched with professional interest as Miracle demonstrated his improved mobility, trotting in small circles and even attempting playful kicks. "I've reviewed his complete file," Jennifer said, clearly impressed, "but seeing him in person is remarkable. Cases of ENE this severe typically have a much longer recovery trajectory, with more significant residual deficits." "Dr. Morgan said something similar," Emma replied, watching as Miracle nudged a large ball they had introduced as part of his coordination therapy. She believes Serena's interventions made the critical difference. "The research team at Valley View is quite excited about the data you've been sending," Jennifer commented. "Dr. Winters called me personally before I came out here. He mentioned they're organizing a special symposium on interspecies healing approaches, largely inspired by Serena and Miracle's case." The news filled Emma with quiet pride. The ordeal they had endured was transforming into something meaningful that might help other horses in the future. As spring turned to summer, Miracle continued to flourish. The daily therapy sessions became less intensive as his strength and coordination improved, though Emma maintained the routines that had proven so effective during his recovery. By his 3rd month of life, a milestone Emma had once feared he might never reach, he was galloping alongside Serena in the larger pasture, his movements fluid and natural, betraying little evidence of his earlier struggle. One warm evening in July, Emma sat on the fence watching Miracle race in joyful circles around the pasture, his chestnut coat gleaming in the golden light of sunset. Serena grazed nearby, occasionally lifting her head to track her foal's exuberant movements. "He's going to be fine, isn't he?" Emma said softly to Serena, who had approached the fence and now stood beside her. The mare nickered gently, pressing her head against Emma's shoulder in what felt like agreement. Dr. Morgan, who had come for a scheduled follow-up visit, climbed up to sit beside Emma on the fence. "Based on everything I'm seeing today, I'd say more than fine. He's thriving. You'd never know what he went through just looking at him now." "Thanks to Serena," Emma said, stroking the mare's sleek neck. "And all of you at Valley View, of course." Dr. Morgan smiled. "You know, his case has caused quite a stir in veterinary circles. Dr. Winters presented the preliminary findings at a conference last month, and the response was overwhelming. Researchers from several universities have expressed interest in studying Serena's healing behaviors further." "Would that mean more hospital visits?" Emma asked with concern. "Nothing invasive," Dr. Morgan assured her. "Mostly observational studies if you're willing, but there's no pressure. What matters most is that Miracle has made a full recovery, something many of us wouldn't have thought possible those first few days." As they spoke, Miracle came galloping toward them, sliding to a playful stop near his mother. His eyes were bright with life and mischief. All traces of the neurological devastation that had nearly claimed him now vanished. He nickered to Serena, who responded with a gentle nuzzle, their bond visibly stronger for having weathered such a profound challenge together. Emma watched them with a heart full of gratitude. The journey had been harrowing, filled with moments of despair when she had feared the worst. Yet through it all, Serena had remained steadfast, her maternal wisdom and healing instincts guiding Miracle back from the brink with a devotion that had moved an entire hospital staff. As the sun dipped below the horizon, painting the sky in vibrant hues of orange and purple, Emma reflected on the miracle they had witnessed, not just Miracle's recovery, but the deeper miracle of a mother's love, powerful enough to transcend the boundaries of conventional understanding and illuminate new possibilities for healing. In the soft twilight of Willow Creek Ranch, with Miracle prancing joyfully across the pasture and Serena standing sentinel nearby, Emma felt a profound sense of peace. Whatever challenges tomorrow might bring, the remarkable journey of the past months had taught her an enduring truth, that in the sacred bond between mother and child, whether human or horse, existed perhaps the most powerful healing force of all.